Hi, my name is Peter. I'm from Point of Care Diagnostics and we're the supplier of the DiaSpect Haemoglobin meter that you're going to be using in your stores. This is a training video to show you how to use the meter. This is the DiaSpect. It runs on an internal rechargeable battery which is good for 10,000 tests or up to 40 days of continuous use without needing a recharge. We do recommend that you recharge it every 6 to 9 months whether you're using the meter or not, to avoid the chance that it might discharge to the point where it cannot take a recharge. On the display of the meter, we can see up the top 3 dashed lines. That is where the result will be displayed. It will be displayed in grams per litre. So for instance, on a male it might be 130 grams per litre or 115 grams per litre for a lady. Directly below that we see the outline of the cuvette that you take the blood in. If the outline of the cuvette is solid as it is now, then the meter is telling you that it is ready for you to insert a cuvette and run a test. If the outline was flashing, that means remove the cuvette that's currently in the holder. Next to the cuvette is a tick sign. That's telling us that the last thing we did with the meter worked correctly, and so whatever is displayed on the screen is correct. And last of all, down in the bottom corner, you can see the battery icon. That shows you how much charge is left in the battery, and this one's ready for a recharge. Alrighty, now we're going to do a patient test and show you how the process works. First of all, we divide the process up into 2 parts. One is making sure the operator is prepared, and the other part is making sure the patient is prepared. I need to get all of my bits and pieces out and ready to go. That means a cuvette to do the test with. The cuvettes come in bags of 100. They're reagent free, so very stable. They will last for up to 2.5 years from date of manufacture. Their expiry date is printed on the bag. There's no front or back on the cuvette. It doesn't matter which way you insert it. On the cuvette there is a clear square space up near the top. That's where the sample will sit. It takes a 10 microlitre blood sample and you fill the cuvette by touching either corner to the blood drop, and it will fill by itself by capillary action. We also need a lancet to do the finger stick with, and then with the patient preparation side of things, we need the patient to clean their hands first. So we'll get you to use the hand sanitizer. Always the way. Beautiful. Because the hand sanitizer is alcohol based, we're then going to clean off the finger that we're going to do the finger stick with, because alcohol can cause falsely low hemoglobin levels. So are you right or left-handed?
Left-handed. Sorry, I'm right-handed.
Beauty, I'll do your left hand if that's
Yep.
all right.
Sure.
What we aim for is one of the middle 2 fingers. Try and avoid rings, because rings can impinge blood flow, especially if they're tight. So I'm going to select this finger here. I'll keep a nice flat palm, clean the finger off, and we're ready to do the finger stick. Prime your lancet. Aim for the plantar surface of the finger, right out near the tip and off centre. Press the lancet firmly against the finger, depress the trigger, and now we get a ball of blood to form. We wipe away 1 drop, 2 drops, 3 drops, and now collect the fresh sample. Fill the cuvette in one go. You can't partially fill a cuvette and then refill it. You need to fill it in one hit, otherwise you run the risk of introducing air bubbles into the sample and getting an error message. Wipe down the outside of the cuvette to remove any excess blood, pulling back away from the opening so that you don't suck any of the sample back out. Insert it into the meter, either face front, press down until it beeps, and there's your result. The cuvette is flashing the image. That's telling us to remove the used cuvette in the meter. A tick to show that everything worked. Alrighty, so that's how to run a test. It's nice and quick, 1 second test time, and very simple. It's a small sample size. You just need to remember to wipe away those excess drops of blood before you fill the cuvette, and you need to wipe down the outside of the cuvette before you insert it to avoid any contamination of the meter itself. Alrighty, but then we move into the cleaning of the meter, your maintenance. And that's really the only maintenance that you have. You can give the outside of the meter a wipe down with a dry cloth or even a slightly damp cloth to avoid dust buildup. And then on a monthly basis, I suggest you push forward on the back of the cuvette holder lift it out, and then you can clean this as well. You can clean this again with a dry cloth or slightly damp cloth. You can even use an alcohol swab. Just squeeze it out to remove the excess moisture first. And if you do use something wet to clean this, leave it to dry completely before you reinsert it into the meter. Once it has dried out, simply slot it in the top, press it down till it clicks, and then dummy test the device to make sure everything's working. Thank you.